Hi, my name's Becky. I work for Portman Dental. I work with both Chloe Harrington-Taylor and James Critchley, and I am here to offer some advice with a couple of techniques to help prevent both tooth decay and gum disease. First of all, toothbrushing. This is a Braun electric toothbrush. Electric toothbrushes are really beneficial. They rotate at 9,900 rotations per minute, as opposed to 400 to 600 bristle movements with a manual toothbrush. Unfortunately, electric toothbrushes don't come with instructions on how to use them, so I'm just going to offer a few tips to help get the most out of an electric toothbrush. So, here is an upper arch. The way in which you use an electric toothbrush. Work systematically. Start in one place. I would start up here, top left, and you have to position the brush right on the gum margin where the gum and the tooth meet, right along this line here. You position the toothbrush, then you press start and you hold it there for 3 seconds before moving. You keep the brush still. That enables the bristles to do the work along the gum and tooth margin. If you're moving the toothbrush, the brush doesn't have time to effectively remove the plaque and the debris from the margin. That is where all the bacteria collect. Then we would move on to the lower teeth. Again, positioning the brush along the gum and tooth margin, holding for 3 seconds before moving along. You can then change your angle. Okay, and once we've gone along the outer surfaces of each arch, we would then move onto the inner surface, pushing the tongue down and moving the bristles along. Using this technique, sometimes this will take longer than the 2 minutes that the timer has on the electric toothbrush, but it's a really beneficial way of getting a really thorough clean. If you do have a manual toothbrush, again, work in a system. On the gum and tooth margin and small circles. You don't need to press hard, just small gentle movements all the way along, and just spending time so that bristles can do the job. Again, all the way along at the top, all the way along at the bottom, right on the gum and tooth junction. And then on the inside, pushing the tongue down, all the way along. Small amount of toothbrush on the brush first. This is an Oral-B toothbrush, Oral-B toothpaste. You only need a tiny amount. Then, after brushing, the use of interdental brushes. These are called TPs. They're a really, really good brush. Red and blue are a really good size to start with. They do come in a lot smaller sizes, pink and orange, which is really good, especially if people are crowded, have lots of crowding in the lower anterior region here at the front. But red and blue are a really good general size. There are a lot bigger brushes as well, but usually if you're used to using these, then your dentist or hygienist will recommend the larger brushes. And these are used every single gap in between the teeth. Right here at the top, there should be a small space, and the brush goes in. Once you've navigated the brush in between the teeth, 10 to 15 times in between, and then come out and then move along. In between, 10 to 15 times. If you're not used to doing this method of cleaning, then you may experience quite a lot of bleeding. If you do, then that isn't a sign that you're damaging yourself. It just is a sign that you're moving the plaque and the bacteria that have been stagnating in those areas for quite a while. A good couple of weeks of that technique and the bleeding should stop. After 2 or 3 days, the bleeding should get less. And it isn't a sign of damaging, so you need to work through that bleeding and keep using that technique every day. And then the bleeding should stop and the gums will become a lot more healthier. They'll become a lot more tighter and a lot more pink rather than red and inflamed. So that's one way of preventing gum disease, which would be really beneficial.